When I was younger, I was really active. I'd go to school, come home, go outside. We'd either go sliding or, play marbles.
She was always very active, active member of the Legion. She wasn't home, she was always down there volunteering.
The pain, I think, probably started around 2005. The pain was in the calf of my leg. I would lock up almost like a Charlie horse, and I had to find something to sit on, and I actually sat down and cried. The pain was that bad.
Things progressively started getting worse. Like I noticed, she didn't want to do much.
I'd go out with my granddaughter for Halloween. I couldn't do that no more. I love to dance, and I go out quite often, and I was crippled when I'd leave the dance floor. I just couldn't do no more.
We were at the apple orchard one day. She just locked up, and she was grasping onto her leg and her muscles in the back, and she was crying, and he said, you gotta go see a doctor. You have to see why this is happening.
I went to the doctor, and he said it was arthritis. I tried different pills, and nothing seemed to help. Finally, he sent me to Dr. Nasser.
Inez came to see me in July of 2011. From the right groin down to the foot, there was no pulse on the right side. There was quite a significantly decreased pulse on the left side, and this indicates blockage of the major, like the big arteries coming from the aorta. Peripheral arterial disease, let's say systemic disease that affects all the arteries of the body. The muscles cannot perform to the ability of the patient, and they will have pain that will force them to stop after walking a certain distance. Peripheral arterial disease has been underdiagnosed and undertreated because 50% of the symptoms are atypical. Those patients have 3 times higher risk of having a heart attack or stroke. Before the availability of minimally invasive intervention, the patient would require a big operation where we cut them basically through the abdomen. The patient will be admitted to the hospital for 7 days, and it takes them about 2 to 3 months to fully recover from the surgery. I had to use a specific tool that is provided by Cordis, which is a division of Johnson & Johnson Medical Company. We start with a needle, and when you reach the area of blockage, you have to go beyond the blockage. Then you can introduce a stent, and the idea of the stent is to provide a scaffold, basically, to prevent the artery from collapsing on itself. And the stent comes on a catheter. The tip of the catheter is delivered to where the blockage is. Without those tools, she would have gone to the major surgery. Whether from the hospital aspect, the physician aspect, the patient aspect, it created a shift in the way we think. For example, hospitals, they don't have to admit the patient anymore. The morbidity and the mortality of the procedure are really minimal. Like the risk is only like 1 to 2% compared to 7 to 10% with the open approach. Patients are happy because they don't have to stay in the hospital for too long. They go back to their normal, regular activity.
Within a week, I was up dancing again. Didn't take very long, and I was going again.
Her life just changed dramatically. To put it in her own word, like she said, I have my life back now.
I can't believe the difference in her life and in my life. Obviously, we can do the things that we enjoy doing together again. She
was doing all her dancing, her walking. She had no limitation whatsoever.
It's amazing the difference that has made for me. It's such a minor operation, and it gives you a whole new outlook on life. I would recommend it to anybody.
I feel like I have my mom back. I believe she's better than she was 10 years ago.
It's wonderful. It makes me feel wonderful.